Hi, my name is Amy Stein, and I am the founder and one of the expert pelvic floor physical therapists at Beyond Basics Physical Therapy in New York City. I am the author of Heal Pelvic Pain, and I have been on the board of the International Pelvic Pain Society since 2007. I have been diagnosing and treating abdominal-pelvic pain disorders and various pelvic floor dysfunctions in men, women, and children since 1999. I am here today to explain to you what exactly pelvic pain is and to guide you through a video that can help you in your healing journey. I am first going to go through the anatomy of the pelvic floor, the function and dysfunction of the pelvic floor muscles, and then go through various breathing techniques, massages, stretches, and at the end, some behavioral modifications and self-care strategies. In the past decade, there has been more and more research on chronic pelvic pain in men, women, and children. And fortunately, physical therapy has proven to be a very successful form of treatment for musculoskeletal causes of abdominal-pelvic pain syndromes. Statistics have shown that up to 20% of women between the ages of 18 and 50 suffer from chronic pelvic pain syndromes. 1 out of every 4 women suffers from pelvic floor dysfunction at some point in their life. A male study showed that up to 88% of the men with pelvic pain had pelvic floor myalgia, meaning muscle pain of the pelvic floor, and pelvic floor dysfunction. And up to 43% of all women suffer from dyspareunia, which means painful intercourse or penetration at some point in their lifetime. Dysfunction in the pelvic floor muscles and/or nerves can cause pelvic pain, and the signs and symptoms can be confusing for the healthcare provider and the patient. They can mimic UTI-type symptoms, urethral bladder burning or frequency. They can also mimic yeast-type symptoms of itching and burning in the vulvar area, as well as prostatitis-type symptoms. And it has been shown that 95% of prostatitis is non-bacterial in nature and most likely a musculoskeletal dysfunction. Common pelvic and abdominal pain conditions can include some of the following: vulvodynia, vestibulitis, vaginismus, dyspareunia, endometriosis, non-bacterial prostatitis, pelvic floor tension myalgia, pudendal neuralgia, levator ani syndrome, interstitial cystitis or painful bladder syndrome, irritable bowel syndrome, and various bowel disorders. But it's more than just a pelvic floor. It's essential that when you're doing this video, as well as if you are able to find a pelvic floor physical therapist, that they address the body as a whole. They address the external muscles as well as the internal muscles, because those muscles can be just involved or possibly even more involved in the actual pelvic floor. You can have your legs straight out or they can be bent, whatever feels more comfortable. You're going to take one hand and put it on your lower abdomen gently, and take the other hand and put it on your chest. Your chest, your shoulders, and your head should stay relaxed. You do not want your chest to rise as you're doing the deep breathing, but you do want the abdomen to rise. So as you inhale, the abdomen rises, the chest stays relaxed. And as you exhale, the abdomen falls and the chest remains relaxed. Now we're going to go through other techniques, starting with the abdominal region. I'm first going to have you practice using your fingertips. So in a V shape with gentle fingertips, you're basically just going to go systematically down the muscles of the abdominal wall. Once you find that tender or tight spot that I mentioned earlier, so you're looking for a taut band or a painful spot, you're going to hold it for 60 to 90 seconds. Again, moderate pressure. You want to feel something as you're doing this. If you don't feel very much, you're not pressing hard enough. But use that same 4 out of 10 pain scale. As you're pressing down on that tight or painful spot, I want you to take a couple deep breaths and really try to practice that deep breathing that we went over earlier. So take a couple deep breaths and really try to feel the tissue soften underneath your fingertips. And you're going to start in the same area, so right against the pelvis, and you're going to massage down towards the knee. Using moderate pressure. If it feels tight or tender, keep going. If it doesn't feel tight or tender, then you can move on to the inner thigh or the adductor muscles. The internal rectal massage techniques can be used for both men and women. Women, if they're experiencing too much pain vaginally, they can start with the rectal massages first. You are going to get to some of the same muscles and tissues that you would vaginally. And then once that feels comfortable, you could proceed onto the vaginal massage techniques. So you're going to go to the 6 o'clock position at 1 inch in, and you're going to apply moderate pressure. Too light a pressure isn't going to feel like very much. Too strong a pressure may increase pain, so you want to use moderate pressure. And remember to use the 3 out of 10 pain scale, with the 10 out of 10 being the most excruciating pain. You don't want the symptoms to go above a 3 out of 10. If they seem to be going above a 3 out of 10, you need to lighten up on the technique. If they're still going above the 3 out of 10, then stop that area altogether and go to other areas, or just continue with the external massages first, and then go back to the internal massages a couple weeks later. So we're going to get started. The first stretch is going to be the pelvic floor stretch. And this is a stretch that you relax the knees out to the side and you grab at the ankles. If it feels uncomfortable to grab at the ankles, then you can also grab at the knees. If it feels uncomfortable for your knees for any reason, if you have any knee pain, then you can also grab behind the knees. So do whatever feels right for you. You're going to hold the stretch for approximately 30 seconds to 45 seconds, and you're going to practice the deep breathing with each stretch. And we're going to do that one more time. Practice the deep breathing. Really feel a lengthening in those hip flexors as you're stretching them. If you want to add even more of a stretch to the hip flexors, you can actually tilt the pelvis forward or under. So you're tilting the tailbone under. That will allow for an even deeper stretch into the hip flexors. The goal of physical therapy and of this video is to decrease pain and symptoms, to improve joint range of motion, increase muscular strength through guidance, and improve function. In Chapter 2 of my book, Heal Pelvic Pain, there's a symptoms questionnaire. I highly recommend that you fill out this questionnaire prior to starting this video. It will help you in monitoring your symptoms through the next couple months of doing this video. In an article in the Journal of Clinical Obstetrics and Gynecology, Prendergast and Weiss stated, "The symptoms of pelvic pain often do not appear to be of such a nature that the patient seeks out a physical therapist to help. The first step in the process, therefore, can lie with the physician or you, who is able to identify the signs and symptoms of musculoskeletal disorders."